Are you concerned at all about the importation of fentanyl into Ireland from Latin America and other places?
In relation to fentanyl, Ben, and you're asking about fentanyl, and I personally raised it at the Citizens' Assembly last September that we did have concerns of the synthetic opioid fentanyl that Irish groups and European groups were considering, that they were going to supply that dangerous drug into the European market and Irish market because of the issues surrounding the decrease in the opium poppy cultivation in Afghanistan. That was in September. Thankfully, there have been no cases of fentanyl in Ireland yet that have given rise of concern, but we have had a number of very significant incidents since commenced, I think, last November, where the synthetic opioid nitazene has actually been responsible for multiple overdoses. It is a concern. It's a trend we were aware that was taking place across Europe among organised crime groups. That has not gone away. Our health service executive and our Department of Health are working very, very close. There's a national red alert group has been established, which is chaired by Professor Eamon Keenan, who's the clinical lead in the HSE, and Garda Síochána is involved in that through the Garda National Drugs and Organised Crime Bureau. These are the dangers for people who are using controlled drugs. Transnational organised crime will do their best to ensure that they can maximise, that they can increase their customer base, therein they can increase their profits, and it's an unfortunate trend that we're going to have to deal with, and it's a trend as well that people who are using drugs are going to have to be conscious of going forward. Thankfully, certain mitigating factors were in place by our Department of Health, and actually the response that the state had in place in advance of even the first outbreak of overdoses has actually saved many lives.